Hello, everyone. Welcome or welcome back to another session of A Day with your fertility specialist. It's always a very nice time to have you around. Sorry for the delay, but thank you for sticking with us. We really do appreciate every tuning in, every day that you come and join us, every like, every click, every share. And on that note, if you think you know someone who would be interested in adenomyosis, they've heard of that topic before and it's new, you can send this link to them so that they can join us and learn a lot more about this topic. And if you yourself are interested in it, stick around and then we'll know a little bit more about adenomyosis. And for that, joining us today, we have Dr. Deborah Olivier.
Thank
Welcome,
you.
ma'am.
Thank you very much,
Yes, so
Joanna.
Dr. Debbie is a family physician. She's the IVF coordinator at our hospital, and she's also a fertility specialist. And whenever we go live like this, we're talking a lot more about how these things affect fertility, right?
Yeah.
So, Dr. Debbie, just to get us started, what is adenomyosis? Can you talk to us a little more about that?
All right. Thank you. Good afternoon, viewers. We're always happy that you join us
Mm-hmm.
every life that we have. So, adenomyosis is a benign condition. When you say benign, it's not cancerous, it's not cancer.
Okay.
This is when you have the lining of the womb, what we call endometrium, present in the muscle part, the uterus, or the in a layman's language, womb,
Mm-hmm.
major parts, the muscle part, and then the lining endometrium, which is the part that then sheds and comes as menstrual blood.
Oh,
So that's the
okay.
part that the
Okay.
woman will say she's having her menses or having her period.
Mm.
So when it's supposed to be present in the inner womb,
Mm.
that's the inner lining of the womb, you have that kind of tissue present in the muscle parts, the body of the uterus. That is called adenomyosis.
Mm.
Yeah.
So how does it differ from other things that affects the uterus, like endometriosis or fibroids? How does that?
Okay, so and endometriosis are related.
Okay.
When you have this abnormal inner lining of the womb or the endometrium present in the muscle part of the womb, adenomyosis, but when it's present outside the womb,
Hmm.
this part is only supposed to be present in the inner lining. Normal growth, you give it gives you the different kinds of fibroids you can have, whether
Hmm.
intramural, subserous, submucous. When this muscle part is growing into the endometrium, that's a submucous fibroid. When it's going
Hmm.
outside, the body of the uterus, that's the subserous fibroid. And when it's just in the part, that's an intramural fibroid.
Okay.
So fibroid tissue is also not a cancerous, condition. It is a benign tumor or benign growth
Hmm.
of the muscle part of the womb. Adenomyosis and endometriosis are very
Related.
related. It's
Okay.
still the endometrial tissue that is abnormally placed.
Hmm.
It's in an abnormal location. But when that location is within the body of the uterus, is adenomyosis. But when it's outside the uterus, is
It's
endometriosis.
endometriosis. Okay, that's actually quite enlightening. But how is the level of diagnosing something like adenomyosis? Because it's not a very popular word, but it is something fibroid
Yeah,
is fibroid.
exactly.
So how is the
Yeah,
diagnosis?
it's not common as fibroid, but a lot of times it's as
Mm.
fibroids. A lot of fibroids are actually fibroids can coexist with adenomyosis.
Oh wow.
Yes, so people could have fibroid normal growth, or the uterus is looking big, large, enlarged. They just think it's fibroids,
Fibroid.
but adenomyosis can also be a cause of a uterus that's abnormally big.
Mm.
Yes, so symptoms, people present in different way, but one of the common symptoms is severe menstrual pain. So
Okay.
people that have very severe menstrual pain
Mm.
could be due to adenomyosis.
Mm.
They also heavy and prolonged bleeding. When a woman is bleeding for more than 7 days, and then
Wow.
sometimes you see this bleeding presents clots, a lot
Yeah.
of blood clots. Yes,
Yeah.
some could also present with chronic pelvic pain. They just have pain in the lower parts
Mm.
of their abdomen, of their
Yeah.
tummy, have chronic pelvic pain. Some could even have painful intercourse.
Okay.
Yes, that's
That
another.
affects that as
Yes,
well.
and then because of the enlarged uterus, the
Mm.
womb is big. They could have this chronic. They just have this chronic pressure that they feel that there's something pressing. That
Yeah.
chronic pressure. Yeah. So those are some of the ways adenomyosis can
Can
present.
present. Okay.
Yes.
Okay. But how does that affect, fertility? Let's get into the fertility sector because it's sounding like, you have where they're not supposed to be.
Yeah.
So how does it affect
Yeah,
fertility?
so it can affect fertility in a lot of ways. It can even affect quality of life.
Hmm.
Even for a woman that's not trying to get pregnant,
Yeah.
especially when you have the severe forms, because adenomyosis sometimes can be asymptomatic, depending on the level of severity. It might be something you just find when you do a scan, or
Yeah.
a woman does an MRI. You know,
Okay.
so that those mild forms might not present with symptoms. But for a lot of women, if it's the severe form, it can debilitate them, can
Mm.
affect the quality of life.
Mm.
A woman having severe pain during menses periods is something you have every
Every
month. So
month. Mm-hmm.
monthly she's going through this pain.
Hmm.
And some people also have prolonged excessive bleeding. They're fainting, they're weak, some even need blood
Oh,
transfusions.
wow.
Yes, the pain is so severe they cannot, it affects their life. They
Daily
can't
life. Yeah.
perform their normal daily
Mm.
activities. Some need to be admitted. Yes, so it can affect quality of life, and then, like you said, it can affect fertility. It affects fertility in different ways. One, because of this abnormal, what happens in endometriosis. Like I said, that tissue, the endometrium, is present in an abnormal location
Yeah.
within the body of the uterus.
Mm-hmm.
So when a woman goes through the normal cycle of menses, when the menses happens, when this bleeding happens, normally placed endometrium, that sheds as an
But.
outlet.
Mm-hmm.
But when this tissue is trapped within the muscle of the womb, so
Oh.
this tissue, this abnormally placed endometrium, will also react, will respond to the same way as the normal
Mm. So
lining.
it's also
So
trying
it will
to
grow when
expel.
when it's going to grow, it will
Mm.
thicken. Then
Mm.
when there's no pregnancy and it's time to shed, it will shed. But there's no outlet for this blood.
Wow.
Yeah, so that blood tissue, that contractile, contraction that the uterus has,
Okay.
that also favors implantation of the embryo. But when you have adenomyosis, this contraction is unwanted, it is stronger.
Mm.
So, for example, an embryo that's trying to implant, that embryo can even be displaced, can even be expelled
Mm.
out of the uterus. And then it causes structural changes that impairs the blood flow to the
Okay.
womb. Yes,
Okay.
and then for embryos to implant and develop normally, for a pregnancy to develop, there must be
You
adequate blood
need it.
flow.
Yeah.
So that blood flow is not there. So you see that women with adenomyosis, they are predisposed to having early pregnancy losses,
Mm.
miscarriages, implantation failure.
Interesting.
If implantation happens, then there's early pregnancy losses.
Mm.
And then this environment is a highly hystrogenic environment. So the progesterone environment is not allowed to function. So
Okay.
the endometrium doesn't thicken
Thinking.
as it should. So that doesn't favor pregnancy and implantation happening. So those are some of the ways that adenomyosis could lead to infertility.
Okay. So, but you mentioned when a woman undergoes a scan or an MRI, these things can come up. What's the effective way of actually seeing and having a difference between the fibroids and adenomyosis?
Okay, so even from can
Mm.
make a diagnosis,
Yeah.
you can differentiate between a thyroid and adenomyosis. The way they present on the scan is different. Yes, but MRI will help you to classify it better. MRI
Okay.
will be able to tell you if this is if it, the adenomyosis is focal, focal, just localized to a particular area of the uterus, or it's
Yeah.
a global thing.
Yeah.
Yes, and then the severity. So MRI, so both of them have their place. And MRI will help you to, differentiate it better. But even from a pelvic
Pelvic
scan,
scan.
ultrasound scan, you can differentiate fibroid and adenomyosis.
Okay. Okay.
Yes, there's
So
a way it looks like with
okay.
adenomyosis. It looks
Yeah.
globular. There are some other terminologies
That
I don't
you
want
look
to
for.
use to.
Mm.
There are ways fibroids present on
Okay.
the scan too.
Okay. Okay. So you spoke about how it can increase the risk of miscarriage or
Yes,
early pregnancy loss, and
yes.
I'm sure that's already worrying to some sort of you know these symptoms that Dr. Deborah just shared with us. What can you do to someone to increase the chances of even a successful full-term pregnancy with adenomyosis?
Okay, so we're talking fertility. So
Yeah.
someone get pregnant. So usually it's better to before even pregnancy occurs to treat. And
Mm.
there are various modalities of fertility. You know, you want to stop this abnormal environment. You want to stop, this abnormally placed endometrium from being active.
Okay.
So that the blood does not get to continue to, and that
Entrapped.
damages the uterus.
Mm.
So we usually place them on. There are drugs you can do that help to induce like state.
Oh,
Yes, so
okay.
that's what. Yes, for
It's
example,
interesting.
for example,
Hmm.
you're planning for an IVF. You want to induce a menopausal state because we know in menopause women are not menstruating.
Yes,
Yes, so the
yes.
body going through those hormonal changes that occur with the menstrual cycle,
Okay.
so that these abnormally placed endometrial tissue are no longer active. Helps to reduce the bulk. The
The
more the
uterus.
tissues are functional, the more the uterus keeps enlarging,
Mm.
the more the damage to the uterus. So you just stop the woman from having normal menstrual bleeds. For IVF, that's what we do to stop the woman from having normal menstrual bleeds, so that the uterine environment can return as normal,
Okay.
its normal state as much as possible. Then you start your IVF treatment process. Other key or how large the uterus is, you can also do a surgery to reduce the mass of this tissue,
Okay.
adenomyosis, to
Okay.
reduce abnormal tissue mass. So a debulking surgery can be done to reduce the mass of this tissue.
So is that usually only advised when the uterus is quite bulky or at
Yes.
any stage?
No, the uterus must be, for you to do that debulking. So
Okay, it
it
has to
means
be.
yes, the uterus must be bulky. So that can be done to you to reduce the size of the uterus.
Uterus. Okay.
All these things are temporary measures.
Mm.
Because once you stop the drugs, the menstrual cycle resumes, the parts again.
Yeah.
You debulk, but if menses still continues, the tissue
It's going
it
to
can form
still.
back.
Mm.
But for someone getting pregnant, someone wanting to get pregnant, you won't go to the definitive management for adenomyosis is a hysterectomy, removing the uterus.
Oh wow.
Yes, but for someone that wants to get pregnant, you can't go to the definitive,
Yes.
management. But there are people that have very severe forms,
Mm-hmm.
of adenomyosis that, despite all these measures, the uterus is just not conducive
Mm.
to implantation of the embryo to carrying a pregnancy. And unfortunately, in those kind of women, you might want to suggest surrogacy to them. That
Okay.
might be the
Yes.
way out
Yeah.
for them. Yes.
I was actually going to ask about that. What
Okay.
assisted, reproductive technologies, or would I say like, IVF, like you mentioned, would
Yes.
help to bypass, this adeno
Okay,
my
so surrogacy is the only
is the only actual
thing,
feasible one,
yes, that can
because
bypass, so that
as
you
long
no
as
longer.
the
Yes.
uterus has those adenomyosis, it's
Yes, because
difficult. Mm.
yes, so surrogacy will be the way out
Way
in that
out for them.
circumstance. Yes.
Okay. Well,
But it's not as if pregnancy can happen
ah,
in a woman that has
you're
adenomyosis.
reading my
It
mind,
depends on, it's
literally.
difficult depending
Mm.
on the degree. Some people have very mild forms, some have moderate, some have very severe forms.
Okay.
Yes, so it depends on the degree of the the severity of the adenomyosis. But pregnancy is difficult. in situations of adenomyosis
But
pregnancy.
it's still possible.
Depending on the degree, yes,
Okay,
it's still
depending on the
possible.
degree of it. And
Yes.
then apart from it just being possible, the success, or let's say the actual term of the pregnancy and actually giving birth, like it's
Yes,
not just getting that. You
yes, they
mentioned,
carry
losses
early
losses of
pregnancy
pregnancy,
losses.
yes, and then
Yes.
miscarriages.
Yes.
So
So what you do, we give additional support,
okay.
drugs, progesterone to further support the pregnancy in that early stage. Those
Hmm.
are some of the things we can do. Yes.
Okay, but what would you say to someone out there that feels a little bit discouraged by, the repeated struggles of
Hmm.
infertility, especially when they already know, like, okay, they have adenomyosis, or even if they don't know, but maybe they might be thinking of it now since you've mentioned some symptoms around it.
Yeah.
Yeah. How would you, encourage them a
Yeah, so
little bit
we,
for
we we
us?
want to encourage, like I always say, when there's life there's hope.
Hmm.
You it's only someone that is dead that there's no hope for that
Yeah.
person any longer. So keep hope alive. See your fertility specialist, see your gynecologist.
Hmm.
Listen to the you're giving.
Okay.
Yes, listen to the counsel you're giving and enumerate the various things you can do.
Yeah.
Be open to the counsel you're doing and giving, and if it has to be surrogacy, be open to that.
Hmm.
If that's the way to achieve your
Your
conception
goals.
dream, your dream of having your babies,
Hmm.
yes, it's your garment that is you, so you still have a connection with that baby,
Yeah.
because that's always the fear that
True.
people have. Yes.
Mm-hmm.
The thing about adenomyosis is that if the woman is still in the fertile age group, woman is still young, her ovaries are not affected if it's just adenomyosis, so she can
Mm.
still produce eggs.
Yeah.
Yes, it's
Okay.
just the uterus that is
Yes.
affected in adenomyosis, as
Okay.
opposed to endometriosis, which could affect the ovaries
Hmm.
and could lead to um, the ovaries not being able to produce good quality eggs.
Okay.
Yeah, but with adenomyosis, if a woman is still young and producing eggs, her eggs can be used. It's just somebody else to carry the
Carry.
pregnancy.
Okay.
Yes.
Well, that's fine. Thank you so much, Dr. Debbie,
Thank you.
for going into the little bit more. I know it's not a very common topic,
Yeah, it's not.
and I hope someone out there has learned a bit more about this. If you heard adenomyosis, or you've recently been diagnosed with it, and if you relate to some of these symptoms, like I've here times we have a lot of symptoms that are very similar. Do well to visit your specialist, your
Yeah.
fertility specialist, your gynecologist, and just what it is. And when you know what it is, then you can start your there is life, there is hope. So don't give up hope on that. Your dreams can still be accomplished someday. Thank you so much for joining us. It is always lovely to have you here. I hope you've learned something new today, and we'll see you next time. We are live every Wednesday and Friday by 3 p.m. on Instagram, on YouTube, on Facebook. You can find us at Alps Hospital. So yes, do well to join us. And if someone sent you this link, please stick on Friday's live. So you send the link to someone else, and then you can learn about a new topic. We have very interesting things in store for you. Have a great day. Bye.